take you back to Sandton, north of Johannesburg, where health experts are gathered for the TB conference. They'll look at how AI, among other things, can assist in fighting tuberculosis. South Africa, as a member of the United Nations, has made a commitment to reduce TB deaths by 90%. Newzroom Afrika's Nqobile Madlala joins us now with more. Good morning, Nqobile. What are the latest developments on the ground?
Well, at this point, there's a closer look in terms of how occupational TB can affect a lot of people that work in the mining industry. And you will understand that since South Africa has got quite a lot of mines, you can just imagine how many people are affected by this TB. But of course, we're going to get deep into it to understand it better. I've got Doctor here to speak to us. Doctor, if you could just perhaps unpack it for us. How does somebody in the mine get this disease?
So as we all know that mining involves a lot of blasting. So from blasting the reef or the ore, there's something called silica. So after blasting, of course, there is a re-entry period before people come in. But as they drill, there is this silica. This silica, once it gets into your lungs, it causes something called fibrosis, and it's over time. So because it doesn't end there. So it's a continuous inflammatory process. So people actually get this disease maybe 10 years, 20 years, or 30 years, even after leaving the mining industry. And because of the fibrosis, then they are vulnerable to TB infections. They actually have got about 3 times the risk than the normal population.
How do we fix this? Because, I mean, the mining industry is quite big in South Africa, but how can it be fixed?
So I think there are 2 aspects to it. There's a legacy part and prospective moving forward. The legacy part is that people were exposed to the silica dust. And most of those guys are now retired, but unfortunately, because of the practices then, they have this silicosis. So from a legislative perspective and government, there is a 2-yearly benefit examination where we go and check these ex-miners to see if they've developed this silicosis. As silicosis is a latent disease, so it's not like TB. TB, you get infected, you get sick, whilst silicosis, it takes time. So that's why there is this surveillance, hence computer-aided diagnosis.
So how are these aided diagnoses in terms of AI going to help someone with silicosis?
So most of the time, the doctors who are not trained in occupational health misdiagnose silicosis as TB. And with the introduction of CAD, computer-aided diagnosis, it's able to aid in the diagnosis of tuberculosis and also in the diagnosis of silicosis. Silicosis being occupational, people who get it get paid as a result. So unlike TB, which of course is just, you can get it from a community. But ex-miners who've got silicosis, also when they get TB, they also get paid a lump sum as part of the legislative prescripts.
All right, and how many people are affected by silicosis so far? Because, I mean, we understand that there's a death of over 50,000 people yearly in South Africa due to TB, but in terms of silicosis?
So it's a difficult one to attribute silicosis to death because what it does, it predisposes you more to other diseases like TB. So you'll find that a majority of people who die of TB have silicosis. So if you put ex-miners on one side and then general population, you'll find that a third of the cohort of people who've died are possibly as a result of the silicosis and TB combined. All I can say is that I think in the last 5 years, we've paid about 1.3 billion rands to ex-miners who we have found to have TB and or silicosis.
All right, thank you very much for speaking to us. Well, as you can hear, quite a lot of money being paid to the people that have been affected. And I think the main point, Masichaba, is that they want to make sure that they find silicosis before it attributes to things like TB in the long term. But now, obviously, all the experts are looking in terms of how to ensure that they can see this much earlier. And this is where AI comes in.